welcome to the listening and viewing public. I am Stacey Carmichael, and this is COVID-19 update. Of course, I am joined by the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, it's a pleasure having you on the program again today.
Well, thank you very much for having me on this program.
You're welcome. My first question to you, Minister, could we have an update on the COVID-19 situation locally? We're seeing an increase in cases. What is the Ministry of Health doing to bolster our response?
Well, a number of things. One, we continue to monitor where these cases are coming from. We have been monitoring in all our regions. We have regional task force that have been established and have been working. And you would see where the hotspots were that they're changing. So, for example, 2 weeks ago, we had a number of cases in Region 9 that has been reduced. Now we have probably less than 10 active cases in Region 9. So we are constantly monitoring, and we try to put additional measures in these areas to contain the epidemic. Our challenge continues to be in Region 4, but when we disaggregate the numbers in Region 4, you would know that we've had a number of cases at the Luziknan prison. So the numbers in Region 4 appears to be high, but when we take the Luziknan prison out, you would see that we have a manageable amount of active cases. We have put a plan in Region 4 with the RHO that is working in Region 4. And the idea is to have all the health facilities that operate in Region 4 to be more proactive in monitoring, in calling, and in helping people who are affected by COVID-19. So this is one of the new arrangements that we have put in Region 4, and we'll continue to put other arrangements in place.
Thank you very much, Minister. Now, we know that the airports are reopening on the 12th. What systems are in place from the Health Ministry's side of things to ensure the safety of the passengers as well as airport staff and, of course, contain the spread of COVID-19?
Well, for first of all, for somebody to come to Guyana, you have to get a PCR negative result. So before you can even travel to Guyana, before you can even get that flight, you have to first of all go to the lab at the place of origin. So let's say you're coming from Canada or the United States. You have to go to the lab. You have to get a PCR test done. That test has to be submitted to the authorities here in Guyana. We will then validate the test that it's an actual PCR test, and then we will pass an instruction on to the airlines that they can book your flight, that they can allow you to be on the flight. We have, with the PCR testing that is done, we have separated into two groups. Those persons who've had their PCR test done within 72 hours, and those that have from 72 to maybe seven days. So you have two groups of people. If your test was done within the last 72 hours, when you land in Guyana, you will go through the normal protocols and you will be allowed to leave the airport because your test was done within this 72-hour period. If your test was beyond 72 hours, then what would happen when you arrive in Guyana? You will go through the protocols and you will be required to do a second test here in Guyana. Second PCR test would be done at the airport. And you will have to remain in the airport until we get back the results. The passenger would have to pay for that, and those arrangements are being worked out between the airline and the passenger and the lab who would be doing the PCR testing. So that's a very clear guidance that have been given to the traveling public that they would have to pay for the second test if the first one was beyond 72 hours. Now, when you leave your point of origin, you get on board a plane, you're required to travel with a mask on so that just perchance, if somebody is infected, that you're protected within this enclosed space. When you arrive in Guyana, we have persons who are at Port Health, and those are Ministry of Health staff. They would um, screen you, and one method of screening that we have is to use temperature. So everybody coming through the airport, at a certain point, they'll be screened with one of these thermal temperature cameras. If anybody who's passed through this section, if their temperature is elevated, then we will move them out, and then we'll further, we have another set of questions to go through with them. If your temperature is normal, then you proceed um, to the next area, which is the Port Health area, where you'll be interviewed by a Port Health officer. They would require a set of information from you. The process shouldn't be too long because we have designed an electronic system. So once you come in, they would already have your name, the name of the passenger, and a number of details on the passenger. So what they will be filling up is more the medical details of the questions that they will have to go through with you. So they'll fill that up. It's all fully electronic. They have computers there and tablets and things like that. And once they finish that, they're able to press send, and it goes to our surveillance department. The surveillance department then take it from there, and they can monitor people after they leave the airport. But at Port Health, once they complete that questionnaire and the Port Health officers are satisfied, they then go to the next stage, and that next stage is those who would have been more than 72 hours, they would be required to now do the PCR test. And there would be several booths that would be established at the airport where the passengers who require that test would go there, they'll get their test done, those samples would be collected and processed, and persons would get back their results. And once they're negative, they're allowed to go. If they're positive, then we have another set of protocols that would come into play. Basically, that person who is positive would have to be isolated. Persons who have been in contact with that person on the plane and in the airport would have to be quarantined to see whether or not they developed the disease. And then they will be taken from the airport with a specialized ambulance and team to one of our isolation facilities. That's in case we have a positive. But we are expecting that the majority of people would be negative. So this is just putting all the measures in place in case we have a positive.
Thank you very much, Minister, for that explanation. Also, there are a series of ministerial outreaches planned to raise awareness in communities as it relates to the COVID-19 pandemic. Could we speak a little bit about that
Well,
initiative?
as part of Operation COVID Curb, this is just one of the other exercises that we're doing. We recognize that a lot of people in markets, they don't take these precautions. Some of them don't wear masks, they don't keep the distance, not enough facilities are in the market areas for sanitization. So over the weekend, today, Saturday and Sunday, depending on the market days, a number of ministers would be fanning out and going out and talking to people as part of Operation COVID Curb. We are hoping that through this exercise we would raise awareness. Ministers would be taking along with them leaflets, educational pamphlets that we'll be leaving with the persons that we encounter. And so we are hoping to cover a substantial part of the country, especially the market areas and community gathering spots, where we can talk to people, interact with them, explain to them the importance of doing the prevention measures, and hopefully that would, get people to start taking on these preventative measures more. So we hope that these one-on-one interactions can help people to understand the seriousness of this disease.
And Minister, there is also an engagement plan for minibus operators. Could you give us a little update on that as well?
Well, again, minibuses are a critical part of our transportation infrastructure, and because they're moving a lot of people every day, we want passengers utilizing the minibuses to be safe as well. So there's a slogan that we're using: if you don't have a mask, you can't ride. Um, and that is because it is important. You be in an enclosed space for whether it's 15 minutes, 30 minutes, an hour, depending on where you're coming from and where you're going. Um, that enclosed space can, if there's somebody positive, can be an environment for the spread of the disease as well. But we can prevent that if everybody in the bus is using a mask. We can prevent that if, when you're coming in, the conductor sprays some alcohol on your hands so that you can sanitize your hands. And of course, minibuses should not be carrying a full capacity. They should have space in between so that there can be some distancing between people in the minibus. So hopefully, by again raising awareness, talking to people, getting stickers on these minibuses, putting out posters that people would see and again realize the importance of these things. And by having a sticker in a minibus, it's a constant reminder that I need to do this. Sometimes people are very casual about some of the guidance that we've been providing. But if you get constant reminders, I think it helps to bring home the seriousness of the disease that we are confronting. And this is just another one of those pieces of the puzzle that we want to work on to get a different group of people, minibus drivers, conductors, person in the transportation sector generally, to understand the role they can play in helping us to prevent transmission of COVID-19.
Thank you again, Minister. And my final question. There's supposed to be a donation of laboratory diagnostic supplies from the Chinese to help boost the local COVID fight. Just a little rundown on that.
So you would recall that we were saying to everyone that the time it takes for us to process the PCR tests is probably about 8 to 9 hours. There are a number of steps that you have to take, and that is when the sample comes into the lab, you have to purify it, you have to amplify it, and there are a whole series of steps that you have to take. Those steps, we were doing them manually, and that's why it took a lot of time. So the piece of equipment that was graciously donated by the government of China really helps us to automate this process. We have received that equipment on Friday last. It's currently at the National Public Health Reference Lab, and the staff there are working with one of the Chinese doctors who came on the brigade to set that piece of equipment up. They're going to do some test runs, and once that is completed and the staff is properly trained to utilize the equipment, hopefully we can get that equipment being utilized as of next week. That then allows us to reduce the processing time for the samples. So that's something that we really look forward to get that working, because we expect that we can do more samples in a day once we get all the bits and pieces working.
Thank you also to the listening and viewing public. My name is Stacey Carmichael, and this has been COVID-19 Update. Goodbye for now.